So we're going to talk about peroneal peripheral neuropathy. That is a mouthful. Okay, so peroneal peripheral neuropathy. I'm Dr. Martin Rutherford. I am a chiropractor, 36 years, and a certified functional medicine practitioner. This is my colleague,
Dr. Randall Gates. I'm a chiropractor as well as a board-certified chiropractic neurologist.
Together, we run the chronic pain aspect of our practice here at Power Health in Reno, Nevada. These are two separate disciplines, functional medicine and functional neurology. Because of experiences that we've had, we forged the two together, functional neurology working with the brain and the nervous system, functional medicine working with all of the metabolic aspects of chronic disease and pain. And it's proven to be quite a successful model for approaching these chronic problems. Peripheral neuropathy has evolved as one of our largest patient populations. I'd say it's probably 30, 35, 40% of our chronic pain patients, which is a significant portion of our practice. So we've had the opportunity to treat a lot of peripheral neuropathy, make observations. Dr. Gates has done a ton of research on it, resulting in, we're probably going to have a book coming out later this year that he's researching, and I'm kind of translating or editing, whatever you want to call it. And so we're trying to straighten out, clarify this whole world of peripheral neuropathy. There's about 80 different things that cause peripheral neuropathy. Most people are aware of about 4 or 5. Peroneal is a very small sector of it, seemingly, and frankly, it's a what we call a pseudo neuropathy. And when Dr. Gates tells you what or defines what peripheral neuropathy is, the biggest difference for those of you who have think or want to know if you actually have a peroneal peripheral neuropathy is usually it's going to be on one side, versus real true neuropathies are going to be on both sides. There's more to it than that. Dr. Gates will get into that in a little bit. So we're going to give you a little bit of what peroneal neuropathy is, what causes it, and what options you might have in addressing your problem. So I'm going to turn it over to Dr. Gates now. He's done the lion's share of research and, frankly, treatment in our clinic relative to the peripheral neuropathy.
So yeah, peroneal neuropathy is the most common mononeuropathy or single neuropathy of the lower extremity. So we talked about sciatic neuropathy earlier. You can access that video. And the sciatic nerve, which comes through the buttocks, goes down the back side of the leg, and it splits into 2 nerves. The peroneal nerve goes around the front side of the shin. The tibial nerve goes down the calf. And the peroneal nerve is particularly susceptible to injury from people like kicking your shin at a certain point. You've played soccer for many years. We've seen it in baseball players where you have 2 leg bones. You have a tibia and a fibula, and the fibula is right next to the peroneal nerve. Frankly, they mean the same thing. Peroneal is Latin for fibula. And that can cause the nerve to get injured. People who lose weight too quickly can actually get a peroneal neuropathy.
I wasn't aware of that.
Yeah,
so that's why he's doing it.
As well as a variety of other knee injuries.
But I was very aware of the soccer kick.
Even a severe ankle sprain, where your foot does this number and it's called basically an inversion ankle sprain, that can really traction the peroneal nerve and injure it. And lots of times patients who get a peroneal nerve injury, they're going to experience numbness and tingling over the anterior shin. They're going to have a specific pattern of muscle weakness. Now, the numbness and tingling is very synonymous or the same as a low back nerve root lesion, the most common one, the L5 low back nerve.
Occasionally you can get a low back problem, have it skip the buttocks and the thigh, and manifest itself in the peroneal nerve, which could be very confusing.
Tens of thousands
to
of
diagnose. Now, again, we are,
patients.
I was going to say we're chiropractors in addition to functional medicine and functional neurology doctors. So we have a little advantage in that we've had I've been in practice 36 years for starters, but we've had quite more education in this area than maybe a lot of practitioners. So.
And there is a way to diagnose it, and it's especially with the muscle strengthening, because certain ankle motions and toe motions are innervated by certain nerves out of the lower back, as well as the peroneal nerve innervates certain muscles that are the same, but some are different than the lower back nerve root lesion. So that is how it's differentially diagnosed. You can also do an electrodiagnostic study. Some of you may have had that, where they stick needles into your muscles and you hear the clicking of the muscles activating, or they shoot electricity into your leg. Sometimes that's painful. That's what patients most commonly remember.
They say, I'll never do that.
To figure out if they have a peroneal neuropathy versus a low back lesion or sciatic neuropathy, but just know it's pretty common. It can happen, and if you have those symptoms, you need to be correctly diagnosed through a very thorough history, a very thorough exam, and possibly electrodiagnostic studies if there's any confusion to really figure it out.
Yeah, so if you had any of those symptoms, a lot of folks that will come in with that won't have any clue what's going on with them. I mean, they'll have those symptoms, and a lot won't even think it could be their low back, and it can be the low back, and it really the treatment success is based on the evaluation and which one of those is it, and then and relative to a lot of patients come in here are extremely alternative minded. We are considered alternative. But we work in an integrated environment. We have a couple of osteopathic doctors here who provide medical contributions to these cases when needed. And so we're not completely dogmatic on that, because sometimes you may need, what would be the options for some of those? I was going to say surgery or laser.
Yeah, lots of times, yeah, if there's a compression, then you try to remove the compression. We do electrical stimulations to nerve injuries in an appropriate fashion where we don't overstimulate the nerves. That seems to work pretty well as long as the cause of the nerve lesion is being addressed.
The back problem, it might be something that a chiropractor can use, or decompression, or something along those lines. But you need that. That's a tricky one to diagnose, so you need to get a good diagnosis. If you're trying everything else and nothing's going on, then maybe back.
Yeah, exactly.
Low back.
Exactly. So that's what we'd have to say about peroneal neuropathy. I don't think there's too much more, aside from the fact that a lot of patients come into our clinic for peripheral neuropathy, and you explained it in the other video.
Right.
Very, very well, where basically peripheral neuropathy, for most of you out there, means when both feet start to have numbness and tingling. It involves many nerves, and patients will come in because they see that, that we deal with numbness and tingling and burning, but really they don't have peripheral neuropathy. They have a peroneal neuropathy, which is technically...
They told it's peripheral neuropathy, which then you might think, well, it's either my back, or it's my neck, or it's my ankle, which in this particular case can be the ankle or the low back.
Ankle, that's true.
Or if it's in one leg, let me just assure you, it's not blood sugar. Okay. Hey, I've had people come in here with these one legs, and then they go, my doctor told me it was like peripheral neuropathy, and I had to get rid of my blood sugar. I'm like, well, it's not your other leg, it's not your hands, it's not blood sugar problem. So just had people ask that question. All right. I think that kind of wraps it up.
Yeah, and if you have any more questions, go to powerhealthtalk.com. You can also like us on our Facebook page, Power Health, and we'll have peripheralneuropathygroup.com. We're building it week by week, more and more videos going up, so we should get all of our videos up.
Sure.
And we'll talk to you soon. Thanks for watching.